being a NetScout, we're usually involved in the operational aspect of supporting everything that these gentlemen have been talking about. So when I have an opportunity to actually see a program that's put in place that I can actually tell somebody at a dinner party and explain to them and they get it, is always pretty satisfying for me. So one particular one I saw, working with some customers that we have in the private sector down in Florida, I actually saw visualized in a commercial that they started running once they actually got this working. So it was all about telemedicine. Now there's some challenges and some legalities around how far can you offer telemedicine, but
Right, state laws and all
right,
that
exactly.
stuff.
But certainly within a state, and Florida doesn't have a lot of neighbors, so it's relatively easy for them to be able to deliver this service. So the commercial was that there was a mom driving around, a couple kids in the back, dropping kids off, picking them up, and one daughter is coughing. She's constantly coughing. She's wiping her forehead, and mom reaches back, touches her forehead, and it's hot. She goes, "Honey, how long you been feeling bad?" "Ever since I got up this morning, and a little bit last night before I went to bed." So she calls the doctor on her phone, explains to the doctor why she's driving, which is probably not good, explains to the doctor, what's going on, actually hands the phone to the daughter, and it's a video chat, and the doctor's asking, some questions.
Right.
"Honey, please open your mouth." The light turns on the phone so she could see better into the mouth. "Oh, there's a lot of this going around. Hand the phone back to your mom. I'm going to call in a prescription for you. It'll be ready for pickup in about 45 minutes. So doing the work in supporting that effort originally and then actually see it being delivered was really pretty neat. Based on the other thing is based on what we do, we see everything that's running on the networks from an aspect of what you folks are doing. We always see it in context. So relative to big data, which you were speaking about, one of the interesting things our customers have come to us is since you're seeing all this data pass anyways, you could help us reduce the amount of noise around the signal that we're looking for. And we found that was relatively easy for us to do. And I've seen some real efforts in planning, especially around the national conventions for the Democratic Convention and the Republican Convention. I've seen what customers have been able to do with the signal data we've been able to provide in preparing and planning for healthcare and hopefully no advent of some sort of activity, whether it be terrorist or whatever, that could disrupt that.
Sure.